I was talking to an athlete the other day about their sport. We talked about their schedule, their typical routine, and they let me know that they take a couple of ibuprofen every day before practice, just in case. I wanted to talk to you about this because it's not unusual for me to hear this story. Hi, I'm Dr. Goldstein. Let's talk about pain meds in the young athlete. Medicines are often used in athletes when they're in pain, and sometimes they use them even when they're not in pain. Here's some examples of non-steroidal anti-inflammatory drugs. The most common, ibuprofen, which includes Motrin and Advil, and naproxen, which includes Aleve, are commonly found in an athlete's locker room. Some other examples include diclofenac, ketoprofen, and indomethacin, and then a newer family of medicines including Celebrex and Mobic. Aspirin's a non-steroidal anti-inflammatory drug as well, not commonly used in the younger population though. Acetaminophen or tylenol is something we'll talk about today, as well as the family of narcotics, which hopefully we aren't seeing athletes use except perhaps in severe pain and after surgery. Reasons to take medications, including the non-steroidal anti-inflammatory drugs, are pain, an injury, using it for anti-inflammatory uses, a fever or illness, and if it's just a habit, like the athlete I was speaking about earlier that takes it just in case. So which one do you pick? Well, there are medicines that are better for certain situations. NSAIDs are good for fevers or illnesses and a new injury because they're anti-inflammatory medicines. Tylenol or acetaminophen also can be used during fever or illnesses and are probably better with concussions. NSAIDs taken during a concussion sometimes cause rebound pain or a worsening headache after the medicine wears off. There are risks with taking these medicines though. With acetaminophen or Tylenol, the liver metabolizes or clears the medicine. If you take too much or the liver isn't doing a good job, liver enzymes can go up, leading to hepatitis, or in the worst situations, liver failure. With NSAIDs, the stomach can be harmed, especially in those athletes that are dehydrated or not taking it with food. Several studies have been done with young people taking NSAIDs and resulting in stomach ulcers. Those studies show that 10 to 30 out of 100 taking NSAIDs result in a stomach ulcer. And in all stomach ulcers in kids, 15 to 25% of ulcers are caused by NSAIDs. The majority of the other ulcers are caused by a bacteria called Helicobacter pylori. Naproxen and ibuprofen have some risk, aspirin even more, and steroids such as prednisone even more. COX-2 drugs like Celebrex and Mobic have a slightly less risk of causing stomach ulcers, but the risk is still there. Your kidneys can get injured by taking NSAIDs as well. 3 out of 100 taking NSAIDs in the young population resulted in acute kidney injury. And 15 to 20% of all acute kidney injury in kids are because of medication or NSAID use. There's more risk if you're not hydrated or you have previous kidney issues. Other problems can occur with NSAIDs as well, including an increase of heart injury or high blood pressure. Certain NSAIDs have been removed from the market because of these risks, including Vioxx and Bextra. Platelets are less sticky for a period of time taking NSAIDs, but they still work, just not as well. It's a different medicine than aspirin. Asthma can have exacerbations if you're sensitive to NSAIDs. And you can have ringing ears or an allergic or hypersensitivity reaction. Why do we have to be concerned? Well, NSAIDs are over the counter, inexpensive and easily accessible. They're in everyone's closet, locker room, and purse. So because they're over the counter, they must be safe, right? Remember the previous slide. There are risks with taking NSAIDs. They're used for many reasons. So whether you have a headache or you're ill, you just got injured, it's easy for a parent or coach to say, just go get an ibuprofen. And while they do have many great uses, we have to be cautious how much we're using and how often we're using them. And if they're really being used for a reason that they're going to help. or whether you're taking it just in case. They're also used for many ages. Parents start giving their kids NSAIDs as early as 6 months old for immunization pain or a fever. And so we're so used to giving these NSAIDs that it becomes kind of part of our daily routine. Indeed, these are medicines, and we should be thinking before we're giving our young athletes medications. My recommendations are to take the right dose based on your weight, and only take it when it's necessary. Take it for a short period of time. I typically tell my athletes if the medicine's helping, take it for 3 to 5 days or until the pain goes away. But if you're taking it more than 3 to 5 days, it's probably time to find the diagnosis and see if there's another way of helping get out of pain. Don't take it every day just in case. This is a real medicine and has real side effects. You hate to take a medication and then have a bad side effect like a stomach ulcer or acute kidney injury and then have to leave your sport because of that, not because of an injury or just in case. Stay hydrated. All medicines need to be cleared or metabolized through your body, whether it goes through your liver or through your kidneys. A hydrated athlete is always a healthier athlete. And talk to your healthcare provider if the ibuprofen or the NSAID isn't helping. It's time to get help and get out of pain. I want to thank you for listening, and I hope you stay well.